Module 3, Managing the Clinical Experience, Student Strengths and Challenges. As a clinical instructor, you can use the student's learning style as a strength to facilitate success during the clinical experience. Consider that students may prefer to learn by first observing, first preparing, or they may prefer to jump right in and learn from experience. For example, when completing an initial evaluation on a patient with a total knee replacement, one student may need to practice range of motion before attempting range of motion with the patient. Another student may prefer to observe you, the CI, perform range of motion before trying it with the patient, and yet another student may prefer to figure it out in real time through the experience of doing it themselves. While we suggest that you keep the student's preferred learning style in mind to facilitate success, there are times when their preferred method may not be ideal. For example, it may not be safe to have the student jump right in and perform a higher level skill in an ICU setting, and similarly, it may not always be time efficient to observe a demonstration before a new skill. Observing the student's performance helps begin a discussion that can lead to greater understanding and learning. Observations should include competency of clinical practice, student strengths and areas of needed improvement, early warning signs, and the need for remedial work and development. For example, you as the CI observe a student engaging in a treatment that you had not discussed prior to entering the room. Assuming the treatment is safe, this observed skill may be discussed after the session is over to help you better understand what the student knows, what they assumed, and why they chose to implement that particular treatment. To establish competency of clinical practice, a CI must facilitate open communication regarding student strengths as well as areas requiring growth during the clinical experience. Other critical areas include documentation, evaluation and treatment, professional behaviors, and clinical reasoning. Determine the student's strengths and further develop them. Note the areas requiring development and work with the student to bring them up to par. Pro tips: provide feedback in the context of the student's learning style. Allow the student to practice weaker skills in a less threatening environment, for example, with you or other clinicians prior to working with the patient, and provide opportunities to practice weaker skills in a variety of scenarios for best carryover. When identifying areas for student development, focus on skill completion, communication skills, note writing, clinical reasoning, time management, caseload, and flexibility within a session. When creating weekly goals, work with the student to create small, realistic goals that the student will have an opportunity to practice throughout the week. These goals will continue to build over the course of the clinical experience and should end with the level of performance indicated by the school at the final. You will benefit from referencing the APTA anchor definitions in order to create appropriate goals. It's important to remember that according to the anchor definitions, there's a difference in student independence when completing tasks with simple versus complex patient cases. An appropriate weekly goal may read: the student will independently take a history and vital signs on a patient in the medical step-down unit with assistance less than 50% of the time. If a student is having difficulty achieving goals, the school should be notified in order not to let early challenges turn into pervasive problems. The school's role is not only to offer support to the student, but to offer support to you as the CI. If challenges persist, the school may assist with an action plan or learning contract. Student growth and development is best discussed at regular intervals. A weekly meeting between the CI and the student is beneficial to reflect on goals achieved, goals to be continued, and new goals to be created. Monitor regularly and be sure the student is aware of all progress. Provide positive along with constructive feedback throughout. Discuss the use of a weekly planning form in the context of keeping the clinical experience on track. Collaborate with the student to fill out a weekly planning form. Identify long and short-term goals that are consistent with the academic institution for their rotation, for the clinical site, and to meet specific learning needs of the student. Include benchmarks and examples of achievement of the goals you've set together. Be sure to include goals for safety, professionalism, examination and evaluation, and documentation. Feedback should be ongoing in order to facilitate open communication with the student with respect to achievement of goals and overall progress. Feedback can be given in many ways to assess and discuss students' performance during the clinical experience. Examples include ongoing daily feedback with the CI immediately after each patient, at the end of the day, weekly, and at the midterm and final. Feedback to the school can be given to the directors of clinical education by phone, email, or in person during a site visit. Feedback should be specific with examples in the context of patient cases. When delivering constructive feedback, first ask for the students' self-reflections related to their clinical performance. What are their strengths? What do they believe is going well? What are some of the things that they've learned? And ask the student to discuss what they would like to improve on about their performance. Secondly, provide your reflections as the CI on the student's performance. Identify areas of the student's performance that are going well, that need improvement, and be sure to identify any red flags or safety concerns that require immediate change. Finally, discuss any mismatches between the student and the CI's assessment of the student's performance. How does hearing the person's feedback inform your perception? In retrospect, is there anything that either of you would do differently? And what are the outcomes that are expected, and how can each of you support the process needed to get there? Some early warning signs that must be addressed immediately include unprofessional behavior, poor knowledge base, lack of initiation, poor communication, and defensiveness to feedback. If you notice any of these issues early on, they need to be addressed with the student when they occur and can't wait until midterm or final. The CI should openly discuss and document observed behaviors with the student in order to better understand the student's challenges. Feedback should always be direct and related to an action rather than generalized or assuming. A good example of direct communication would be, you arrived at the clinic 10 to 15 minutes late this week. I need you to be on time. Is there something that can be done to get you here earlier? Instead of, you don't seem to care much about this clinical experience. This is a red flag and it will be on your midterm. Behaviors that may be concerning should be discussed with the DCE, which is the Director of Clinical Education, and the SCCE, which is the Site Coordinator of Clinical Education. Be sure to document the facts and how issues were dealt with. Contact the school by email or phone if any issues persist.